Knee pain is a common complaint when sporty children are going through a growth spurt. One of the most common sources of pain in the front of the knee in sporty children, especially boys, is called Osgood Schlatter's disease. But it's not really a disease at all, so health professionals are trying to drop that term. Osgood Schlatters is an old term used to describe pain and inflammation just below the knee, where the thigh muscles called the quadriceps attach via a tendon to a growth plate called the tibial apophysis. Itis just means inflammation, so it should therefore really be called tibial apophysitis. Bone growth puts more strain on the thigh muscles and may cause more traction at the point where the muscles attach to the bone. This is close to the growth plate and tends to cause both traction and compression and shearing forces that act on that immature growth plate, causing inflammation and irritation. Because of this, we don't always recommend stretching the quadriceps, as that can make the traction worse. Many children get tight hamstrings, however, and during growth spurts this may mean that the muscle at the front of the thigh has to work harder to straighten the knee during kicking and running. And that places more strain on that muscle attachment. Whilst we don't suggest you do stretches for the quadriceps at the front of the thigh, hamstring stretches may ease that tension on the quadriceps, so can help some children. Most non-contact injuries in sporty children are caused by a spike in activity relative to what they've trained for. They've exceeded their current capacity of their immature body. That might be because the child did too much too soon, or they might have had a lower capacity than usual due to maybe a virus, a growth spurt, or lack of adequate sleep or nutrition. To learn more, watch the Kids Back to Sport video on why children get injured. Tibial apophysitis is more common in boys than girls, usually occurring around the age of 10 to 12 in girls and around 12 to 14 in boys. But it's not just caused by doing too much sport. It usually occurs when something in their normal routine changes, such as the start of a new season or term, or perhaps there's an overlap in seasons causing a spike in either volume or intensity of activity. More commonly, it affects children going through a rapid growth spurt and those who've had similar pains in their heel at a younger age. The research is still emerging, but it has been linked to low levels of vitamin D and potentially the alignment and the maturity of the shin bone as it develops. The child with tibial apophysitis will present with localized knee pain where the quadriceps tendon inserts into the top of the shin bone just below the kneecap. It will be tender to press or to kneel on, and sometimes it can become quite swollen and a lump may develop. It will be worse on activity and settle with rest. And if this is not the case, it's probably not a tibial apophysitis and therefore needs checking by a healthcare professional. Trying to get kids to do less is never popular, so we need to find a way to increase their capacity to tolerate more activity. Building stronger muscles, getting more sleep, improving their energy intake, and factoring in days where their body can adapt and recover will all help. The aim of treatment is to keep them as active as possible. If they do nothing, their tissues get even less tolerant of loading and the muscles get weaker. However, it is important that they don't cause more harm. In order to understand whether they can play with pain, it's helpful to go through this checklist. We need to reduce the frequency and intensity of activity down to a level that creates only a mild pain, less than a 3 out of 10. It settles within an hour of ceasing playing. It doesn't cause them to limp or change the way they move. And it's no worse the next day and doesn't increase any swelling. So it's good to show children this list so that they can understand how we can make the right decisions that mean that they'll get better quicker and in the long run miss fewer sessions of sport. If they are in a lot of pain, it's worth trying some ice because this can be helpful with some children. But it is important not to give your child painkillers to help get them through a game. This will mask their pain and is likely to just make the whole condition last longer. Other things that can help are trying some taping or one of the specific what we call patellar tendon braces that helps perhaps take some of the tension off the quadriceps muscle. If the child is doing less and the knee hurts, their muscles may get weaker. So it's important to start a graduated strength program, not just for the thigh muscles, but also the calf, trunk, and abdominal muscles. It's critical to get the right exercises for each child and to make sure that they know how to do them correctly so they feel them in the right places and they get the right benefit. There are a few exercises described in the Tibial Apophysitis Kids Back to Sport ebook, but it's best to try to get specific ones for your child. If their pain is persisting with still playing sport, they need to take between 2 to 4 weeks off from all high impact activities such as jumping and running to allow the symptoms to settle. After the pains settle, be careful not to go straight back to doing the same high levels of sport with them that they were doing when they got injured. We need to build them back up gradually so their body can adapt to what is being demanded of it and get itself stronger. To help them get back to sport, try using the Kids Back to Sport tool. Find a level of activity on the steps that they can do with minimal pain and settles quickly without causing more symptoms the next day. For example, they might be able to go on their bike, but not yet run. Leave a day between exercise sessions to assess if there's been any adverse reaction, and if there's not, repeat that same exercise again. If there's no increase in symptoms, move up the steps one level at a time, repeating that process of 2 consecutive training sessions with a day between before you move on to the next level. And it may well take several weeks or longer to achieve their previous level of activity, but this allows that immature bone time to become stronger and tolerate more load. We need to avoid the boom and bust culture where kids keep going back to sport, going too hard, too much, too soon, and causing inflammation back in the symptoms and going in a vicious cycle of getting frustrated with not being able to play. Once the child's back running, they're not yet ready to go back to competitive sport. We need to add changes of direction, stopping and starting drills, and build up the number of sprints to replicate the demands of the sport that they play. In those early matches, limit game time and allow a day between matches so the body can recover and make sure it's ready to go again. These types of conditions can last many months if not treated appropriately. So if after trying to reduce their symptoms, your child is still in pain, it's often helpful to see a health professional with experience in treating young athletes. Not all practitioners have the knowledge or expertise to treat children, so check those listed on the Kids Back to Sport register or ask your local therapist whether they regularly treat children. There's lots of information on the Kids Back to Sport website, so do take a look and see if that can help you get your child safely back to sport.